broadcasting around the world 24 hours a day. This is Carers World Radio with Patricia Mitchell.
Hello and welcome. In our first programme of 2009, we look at a new report about young carers, which was published in December and highlighted the vital role that young carers play in society. The dedication and sacrifices they make are revealed in what has been described as a hidden and neglected group of carers. We look in depth at this new report with one of its authors, Sol Becker. Now, have you heard of carer break vouchers? No? Well, today we tell you about these vouchers and how they may be able to help carers take a break across the United Kingdom. So stay listening. Now, if you're a regular listener, you'd have known that we've been following the Sharon Coleman case very closely with the help of Luke Clements. This case has groundbreaking legal implications for the millions of carers who combine work with caring for somebody. Now, just to recap, Sharon has a son, Oliver, who was born with several disabilities. After some time looking after Oliver and working, Sharon applied for flexible working so she could better look after her son, for example, by working at home sometimes, as other staff members were able to do within the company. But simply asking for flexible working seemed to antagonise her employer. One of the partners of the firm said to Sharon, "Your son is always sick." The final straw at work came when all employees were told the firm had to make one secretary redundant. Sharon felt forced into taking redundancy and emailed a partner of the firm who promptly told her she could go by Friday. As a result, one of Sharon's friends felt Sharon had a case for constructive dismissal. Now, that is where someone is forced out of a job rather than sacked. Sharon's friend put her in contact with a solicitor who agreed she had a case for constructive dismissal. However, it was also suggested Sharon could go for an unproven legal point, namely that Sharon had suffered discrimination on the grounds of disability by association. Sharon's case went to a tribunal who referred it to the European Court of Justice, and I am extremely pleased to say Sharon joins us on the phone today to tell us more in person. Now, Sharon, I've sort of left it teetering on the brink of what happened. Most of our listeners do know. It's all good news, but can you tell us in your own words how this all began? Because it's been quite a journey, hasn't it?
It really has. It's been a long journey, sometimes an unhappy journey, because obviously everything about you is brought under question. Your work ethos is questioned, and stuff like that. But what happened was I could not understand how anybody could be treated the way that I was treated for a situation that was out of their control. And that's when I spoke to a friend of mine who happened to know Lucy McLean of Batesweld and Braithwaite. And she looked at my case, and obviously she found that there was a loophole in the law. And she said, right, we can go constructive dismissal or we can go down this route. And on principle, I just felt that I couldn't have anyone else treated the way that I'd been treated.
Did you know from the minute that you got this advice that you potentially would be turning the tables on your employer, and rightly so, I might add? Or was this something that you thought, I really don't know how this is going to work itself out, but I just have to do this?
We didn't know at all, and I think in your wildest dreams, that's where you want it to go. But really deep down, no, I really didn't think it'd get there. And yes, she was absolutely wonderful, and that is where I wanted to go. I didn't ever want anyone else to be treated like that again.
Because this was an unproven point, wasn't it? This isn't just about unfair dismissal. This is actually about that whole, the clause, discrimination on the grounds of disability by association.
It's on the grounds of, it's just those couple of words.
Yes, right. So what was the first stage like, where you went to tribunal and then to the European Court of Justice, Sharon? You know, did this affect any change in itself?
Well, what happened was, firstly, we'd had a discussion about payments, and bless Lucy McLean, she took that on pro bono for me, and she said, oh, of course, if we go to Europe, then it'll be a different matter, we'll have to discuss it again. So it went to tribunal, and I think it's either never happened before, or it certainly just happened once before, where something goes directly to Europe from the tribunal. So, of course, you can imagine me. I was like, oh, my goodness, I've got to pay all this money now. Oh, my Lord. But, you know, and I still didn't realise how big an impact this case would have. This test case, my test case would have. And Lucy and the legal team said to me, you must come to Europe. So anyway, I went, and I think that's when it hit me how big the case was, because it was in Court 1, and it was packed. It was standing room only,
Wow.
and I think there was about 6 countries that had turned up to speak on it, and, you know, and that's when I thought, oh my, they're sitting here talking about my little case.
Yeah.
So, you know, and
but
then...
it's a big principle. It's a little case and a big
a
principle.
big principle, and it was. And from there, you have to wait for the opinion and then the judgment. The opinion came, and it was, you know, very surprisingly, it went in our favour. And, you know, and I was really surprised. And then we had to wait a little bit extra, and I think we would have hoped for something. I think that was late. The judgment was late in coming back, and then we heard a little whisper that it hadn't gone in our favour. And it was, you know, it was all touch and go. And of course, when it came back, it was, you know, it had gone in our favour. So that was all joyous. And I've even now, I think that came through in November. November, to win the right to have my case heard back at the tribunal. So that's where we stand at this moment.
The case effectively goes on. Sharon, thanks so much for joining us on the programme
today.
today.
Thank you for having me. Thank you.
There are an estimated 290,000 young adult carers aged between 16 and 24 in the UK today. Many of them will have been caring since an early age. Like many carers, some don't even realise they are carers until it's pointed out to them at school or by other health or social care professionals. Now, in December, a new report was published by the Young Carers International Research and Evaluation Team at the University of Nottingham. The study shows that many of these young adults show great commitment to their caring role, even though it can compromise their ability to succeed in life and deprive them of the opportunities enjoyed by their peers. To tell us more about the report, Sol Becker, Professor of Social Policy and Social Care at Nottingham University. I read this report, Sol. I was slightly shocked, actually, at what a lot of these young carers go through. What did you find most shocking?
Well, I suppose, to be honest, Patricia, I don't get shocked anymore by these kinds of studies, because I've been doing them for 15 or 16 years. So that, you know, we've been very well aware over this period that many young people, many children, are providing very intensive forms of care, including emotional support, supervision, doing a lot of the practical household tasks, a lot of intimate and personal care, from very young ages. And indeed, our census figures for the United Kingdom show that children as young as 5 are providing care. Even of primary school age in the United Kingdom are providing over 50 hours of care per week to other family members. And that's in the official census government figures.
I mean, I have to say, I think it was that figure that some have been caring since the age of 5, and also the range of conditions for which they're sort of caring for, you know, ranging from medical conditions, physical impairment, mental illness, drug and alcohol abuse. From your point of view, what do you think were the worst aspects of this in terms of how it affects their lives?
Well, I think that the evidence shows that, excuse me, where children and young people are caring for parents, as opposed to, say, caring for an ill or disabled brother or sister or other family member, but where they're caring for parents, this is most likely to be the kinds of caring situations which have the most detrimental impact on children and young people in terms of restricting their opportunities to make friends, to take on other leisure activities outside the home, to make the best of their education.
Saul, thank you so much and your team for conducting this study. It's been hugely interesting to have this group understood a little bit more. Thank you for joining us today.